to say how you doing.
Hey, how you doing?
I'm doing really, really well. Now I know that you're in the other Washington, but it looks like you guys got some sunlight over there too.
Oh yeah, you can have a little bit of this humidity too if you want that. I'll
No,
share it with you.
I'm let me tell you something. If there's one thing that I'm okay with about Seattle, it's the fact that it rains versus it being humid.
Yes, yes, I do miss that.
Now, for those that don't know, not only are you a doctor, you are one of my favorite kinds of doctors. To be exact, you are a certified internal medicine doctor who
Yes,
practices primary care medicine.
yes, yes,
And you're from Seattle and with UW.
yes. From the UW, a Husky. I went all the way through. I went to Madrona Elementary. I went to Washington Middle School. I went to Garfield High School. Any dogs in the house? And I went to UW. And so I've been in Seattle as a long acting, I guess, citizen, you can say. But I did come over here for med school, went to Howard University. I'm an HU grad, HBCU's in the building, and I've been here.
Congrats.
My parents are still in Seattle. I still spend a lot of time in Seattle, get there when I can. I missed Seafair this year, and the weather was great, but hopefully next year I'll be there.
How do you like it over in DC?
It's good. It's different, right? It's culturally different, right? You have a different cultural mix than you have in Seattle. And then it's just that East Coast mentality. It's funny. I
Yeah.
went back for a high school reunion some years back, and everybody said I spoke fast now. Like, man, you speak so fast. Like, what happened to you? So it's definitely more upbeat. Less chill than Seattle, but it's definitely a good vibe here. There's good people here. I've definitely got a good, solid peer group here, and good friends, colleagues, all that good stuff. So
What's it like being a doctor out in DC versus in Seattle, where, Seattle, there's a very, very small percentage of people that look like us. Over there, you're
yeah,
in, what do they call it? The Chocolate City?
yeah,
So
chocolate.
you guys have like black doctors everywhere. Do you feel like it's way easier to get proper care for African Americans over in DC?
That's a great question actually, and I think there's some reality to that. Seattle last time I checked was between 7 and 8% black. Over here we're much more in the majority, and with that comes a larger professional class. It's not just doctors, there's lawyers, there's all kind of black professionals that are here that are in more abundance than you would have in Seattle. So with that does come that ability to actually see someone that looks like you, culturally identifies with you, and have that relationship with. And so there's definitely a beauty in that. And then within the doctor network, you gotta remember black doctors about 2% of all doctors, right? And so a lot of those are based in areas like the DMV where most of us are residing. And so that helps in just that exchange. I'm working with a couple people. We're trying to put together a good, almost like a green book for doctors, right? And
Mm.
so you have access to referrals. So I have friends that are cardiologists, I have friends that are GI doctors, I have friends that are anesthesiologists. So I have that in my network because they're here. Some of my neighbors. So there's definitely a benefit. You can almost feel it sometimes. I tell people my first time on campus at Howard was just I got culture shock.
Wow.
I looked around. I was like, whoa, like what is this? People live like this, because you have that African diaspora.
Mhm.
Which you don't get that in a lot of places. Being from Seattle, I didn't have Jamaican food for the first time until I came out here to DC. So,
Wow.
yeah, that's real. And things have changed now in Seattle, and you've got a more influx of more cultures. And so, you do have that ability to get those food groups. But yeah, I didn't have my first jerk chicken until I came out in DC.
That is crazy.
Yeah.
I always tell people because I've never been to DC, I've never been to Atlanta. So I always say once I finally do go, or even like Texas, like Houston, I already know I'm going to have a culture shock because the first time that I went, started finding like different parties out here in Seattle where there's a lot of black people, I was like, whoa. And
Yeah.
there was a lot of black people that I didn't know and they were like from out of town. It was just completely different.
Yeah, it's shocking. It's like I said, man, I tread through Seattle. That's where I learned myself. I grew in Seattle. My good friends in Seattle, so I know Seattle. I know what it's like. To go out and look and search and trying to find where we're at. And so you're definitely gonna get some culture shock. But if you come out to the DMV, I'll give you the red carpet. Make sure that you got someone to share it with. So
Appreciate that. I definitely plan on coming out there really soon. Julia Jesse from Clapback Culture is out in DC, so
Oh, cool.
I will
Okay.
definitely be there soon.
Yeah.
Now for the topic at hand,
Yes.
here's the thing. Months ago, I was minding my own business, which I always say is really not a thing when you're on social media. But
Right.
I ended up seeing these posts about discoveries of monkeypox over in Africa. And then I was
Mhm.
like, okay, well, if it's in Africa, that means it's going to be here eventually. Like, I didn't know how soon, I didn't know how long it was going to take. I just knew that if they were saying there was something called monkeypox just popping up in Africa,
Mhm.
and you're just now telling us, that means it's already been circulating and now you just have to find the people that have it.
Yes.
So months later, and over time, of course, I've been telling my audience about it.
Mhm.
Finally, it's here in Washington State. It's here
Yeah.
in America. I want to say on Tuesday, when I checked the numbers for here in Washington State, it was 154 cases. I don't know what it is at this particular point. Oh,
232.
well, damn. And most of it is in King County.
Yes. 200 of the cases are in King County, actually.
See what I mean? So obviously it's making its rounds. And my whole thing is I'm not trying to like sound off an alarm like, oh
Right.
my God. But at the same time, I can't help but think about when COVID first hit King County and it ended up being at an Amazon building in South Lake Union. I
Mhm.
live on South Lake
Ooh,
Union. So I was like, what? Because
yeah.
at that point, it's like, okay, it's here.
Up
And
close
at
and
this
personal.
point,
Yeah.
down the street at that.
Yeah. It's a neighbor.
Literally.
Yeah.
And so, and I think it's the building that was, like, right across the street from my apartment building, honestly.
A true
Uh,
neighbor.
no, seriously. So with that, a lot of people were like, "Okay, it's not a lot of it. It's okay. It's not gonna be that serious." But obviously, a couple months later, we ended up going on lockdown for about 2
Right.
years.
Right.
Can you tell us, one, where the heck is this monkeypox coming from? And with numbers starting to hit the 200s and creeping
Mhm.
up to 300s, what do
Mhm.
you think life is looking like for us in like the next month?
Yeah, so it's interesting, right? There's a lot of discussion out there about the origins of monkeypox. I mean, the latest that I heard, and what we're kind of going right now, is it was in Nigeria for actually quite a long time. Apparently, for the past 10 years, it's been kind of sitting there brewing. There's a couple doctors out there that were actually throwing the warning signs and letting people know in the community that, that monkeypox is here. It's actually changed from, just the normal vector that it was in, and now it's doing human-human contact. And that's the key here. Monkeypox is not usually known for human-human contact spread. And so now that we have that, we have a whole different situation with this disease. And so, apparently what's happened is just gotten outside of Nigeria, it's spread to, other places now in the world. Unfortunately, what that means is that we have to really be prepared for it, because with this human-human contact spread, there is a possibility it can have that increased chance of really dispersing itself throughout our communities. Now, there are some numbers that, we do have to look at, right? We have to really just examine this, the whole picture. So as of now, 98% of the cases for monkeypox are men. Okay, first and foremost. And so that's one statistic we got to be aware of. The second statistic is 95% of those were developed through sexual contact. So there's two things that I want you guys to decipher from that, and which I want you guys to take back, is that one, um, it is sexual contact that you can get this disease. But remember, we now have found out close contact also can give this disease. So that means this can skip from just being in the male population to the total population, right? Putting us all at risk. So I really want to make sure people understand that. A lot of people develop disease so far from sexual contact, but close contact also can transmit disease. Also, we've shown that, just talking to someone from a prolonged period of time, the respiratory droplets can transfer the disease. So we really, really got to watch the transmission of it. So that's kind of my spill, just in regards to monkeypox and where we're at right now.
So, okay, it's not technically a sexually transmitted disease,
No, not
but
by technicality.
it's getting transmitted that way, and 90% of them people that have it right now are
Hmm.
men.
Hmm.
But it's not a herpes,
Mm-mm.
Because I Googled it, because, like, I was like,
Yeah.
"Oh, it's just like general, like, warts
Right.
times 12."
Right.
What is it?
So it's good you brought that up. So it's a pox virus, right? And so pox virus, if you look at it, it's almost like what you do with the genuses and species with animals and things of that nature. It's in its own family of it's called orthopox viruses. So it's a separate family of pox viruses. Chicken pox, right? That's in the herpes pox virus section. So it's in a whole different. So it's not even related to chicken pox at all. And so what it
Wow.
is actually more, yeah, it's completely different. It's in a category that the smallpox is in, so it's closely related to smallpox. Cowpox is in the same category also, and so that's a distinction. And so what we found too that some people there's small amount of people that were vaccinated for smallpox, they are immune to monkeypox because of that. Now the thing with the monkeypox is good is it's so far it's not as life threatening as smallpox is. So there's not a large amount of it's a word we use in medicine mortality, meaning death from it. But things change. We saw how COVID changed, so we just really got to be aware of this and really stay on top of it.
So if anything, it's just more so uncomfortable and looks extremely alarming.
Yeah, I mean, it takes you out the game for about 2 to 4 weeks. So and you got to isolate, right? Because it's
Yeah.
easy transmissible. So you got to isolate. You got to be away from people. I think some of us experience COVID, and that isolation that's hard, right? We're used
Mm.
to social contact, and so I mean, we're still seeing what happens, the ramifications of just being socially isolated for a long period of time. So you always got to remember. Once you get smallpox, you're isolated for at least 2 to 4 weeks. The lesions have to completely heal over before you can get around people again.
I there's something on TikTok, or there at least was one particular TikTok of a guy and his boyfriend had the monkeypox and then passed it over to him, but his monkeypox had completely cleared up, and he said he's taking care of me now because his monkeypox is completely cleared up, and now that he's had it, he can't get it again. Is that true?
So I think we got to wait. I think we got to really see what the data says for that. It's possible, but I think we've learned over the past couple years that things can change. So I think we still need a little bit more data on that.
I'm glad that I did ask that, only because the problem that I have with TikTok, and one of the reasons why I wanted for you to start coming on my show, Dr. Nelson, is just because you get so much information from just the everyday
Yeah.
Joe talking about their current experience, where it was even like with COVID, somebody was like, "So I tried taking an orange and then they put cinnamon on it and they burned it and then they were like they were able to get their taste back." Other
Right.
people just ended up with a burnt tongue.
Right.
So
Right.
at that point, it's like you have all these people doing these makeshift analysis and saying, "Oh, my boyfriend is cleared up of it, so now he can't get it again." And I'm like, these are things to where it's like, if this is true, I need to hear this from a doctor and not just you assuming that your boyfriend can't get it again because he doesn't have any more lesions or anything.
Right, and that's I think information is key and staying educated. I actually now do kind of some sequences, health sequences on TikTok as a roundaway doc for that reason because I feel that I want to disseminate the right information, the correct information. We have lived in a world that false information is occurring more rapidly and is more prolific than we really like, right? And what that does though, that can cause harm because now people are doing things that aren't health conscious and are putting other people at risk. For instance, I think people need to be informed that with the new variation of the Omicron for COVID, usually 3 months were good, but we're starting to see that 1 month it's you possibly can get COVID and then get it again 1 month later. So information is key. Being on top of information is key, and making sure you're getting information from the right person, I think, is going to help us get through this.
That's very true, because there was a point when people were also saying, "Oh, if you catch COVID, you're not gonna be able to get it again." And then all of a sudden people were like, I know someone that has had it twice now." That is not true.
Yep.
Vaccination. A lot of people are literally having to jump from state to state, stand in these crazy long lines in order to get the vaccine. And apparently they just don't have enough of it. Can you tell us a little bit about the vaccine for monkeypox, why it's so sparse? Because from what I've seen, it started honestly in like the 1800s or something like that, and it's just now revving up.
Yeah, so you gotta think monkeypox isn't supposed to be doing what it's doing. So that's kind of throwing us in for a loop. Human spread of the disease just wasn't occurring. And so now we've been put into a situation where now we have to kind of adapt and figure out how to take on this new spread of this monkeypox. So there are vaccines for it. Those vaccines are hopefully going to ramp up and become more widespread. There's no really true general public um, use for the vaccine right now. You can get in certain places in very small amounts, and there's very specific criteria for how you get the vaccine. Mainly, if you're someone that's been in close contact with someone that has monkeypox, which you suspect that you may be getting it. People that are immunocompromised, young kids that are less than the age of 8 that have been exposed. So it's very specific where the vaccine is going right now. I know the government, I know the CDC on their site was saying that it looks like we're going to be trying to ramp up the amount of vaccine that's out there so that we can have it available. But for right now, it's very, very hard to get the vaccine. It's very, very limited.
That does make sense. So basically, somehow, some way, someone got in contact with an animal and just started passing it around to everybody else.
Yep. Yep.
Okay, okay. Well, that particular TikTok was correct. Let me ask you this: being that this is something that isn't supposed to be so transferable from human to human, and
Mhm.
obviously it's happening,
Mhm.
how can you protect yourself? I ended up seeing a news clip where it was like, you can go to the gas station and touch the gas pump and get it. A lot of things are kind of like COVID, but my thing
Mhm.
is if I am not able to get the vaccine unless, I've been in contact with someone that's had it, which
Right.
at that particular point, I might already have it, being
Right.
that it's not only a sexually transmitted thing. You can have a conversation with me, maybe
Right.
sneeze and something,
There you go. Right.
how do I protect myself without just walking around in, one of those clear bubbles?
Yeah, and it's unfortunate, right? Because we just kind of got out of, not got out of it, but we're getting more comfortable with just the precautions for COVID, and now we jump back into kind of the same kind of scenario. A couple things about monkeypox, so I think people should know. Monkeypox is it's one of those things where it can survive pretty well, especially in kind of like dark areas. UV light is very susceptible to, so in the sun it's susceptible, but dark areas, dark rooms, things of that nature, it can actually exist. We've started to see in some studies up to about 15 days. So if you're exposed or if you're around someone that's had monkeypox, or you're in their environment, you just got to kind of be aware that everything needs to be clean. You got to use a disinfectant and clean. And they recommend like a what we call a wet disinfectant, meaning like a spray or like a wet wipe or something of that nature to cleanse down everything, anything that person has touched. And so that's really where we're at with it now, as far as just staying ahead of it and making sure we're not spreading it.
So, one thing that I just thought of, so it's not like something with herpes where it's like you actually have to touch the
Well,
lesions,
yeah,
or I mean, you can,
yeah,
but I feel like with herpes, like, that's one of the only ways that you can
right,
really get it
right,
if they're having the outbreak.
right.
But with this, if you have it and you start having the lesions, if I have a
Mhm.
conversation with you, I might end up catching it.
Yeah, and that's the difference. That's one of those things that you just got, like you said, you have to be aware of that. We are seeing that the transmission is there from just talking to someone for a prolonged period of time. So that is definitely a little different.
I think, let's see. I feel like that might be all the questions that I have for right now. Do you think that within the next couple months, maybe even like 6 months, the vaccine will be a little more, accessible for others? Because obviously, if this obviously isn't a disease that's supposed to be transferred to
Right,
human, they literally probably only had enough for the animals that would potentially need it, and now they're having to, like, quickly get it
right.
together just so that way we don't have another COVID situation. Do you think they're gonna be able to, like, get it? And also, do you think it will be worth everyone going out and getting the vaccine once it is, ready available?
Well, I think what we need, and hopefully we do this in a timely way. A little bit more data, because remember, right now only 90. It's mainly in the male population, so we have to figure out now. Then how does that work? What's the plan? What's the process? How do we allocate? Does the general population still get access to it because there is this respiratory spread, or are we just going to say if you have these specific qualifications, then you get the vaccine? I do know that they're ramping up. They're trying to get more vaccine available because we don't know what this is going to do, right? I mean, as soon as we start seeing more of a cross gender spread, then that it can easily ramp up more right there. So I think preparation is key, and just from what I've been reading and hearing, it sounds like the government, the CDC is trying to get ahead of this before it becomes a big problem.
All right. Well, Dr. Nelson, I want to thank you so much for taking time out of obviously your busy day. You are currently at work. And giving us this information that is so needed right now with monkeypox. So that way, just the entire world at this point can get prepared and make sure
Good.
that they are just just start disinfecting. Like I wipe down the studios these days. I'm like, look, I never know. Okay. Like people coming out of this building all day. If I don't have to touch things, I'm trying not to touch things. Please let everyone know where they can find you at on social media to keep up with like your TikToks and on your Instagram and all of your amazing um medical content that you're just sharing with the world right now.
Yeah, yeah, definitely. I really believe right now that, information is key and I want to spread good information. So I am on Instagram. I'm also now on TikTok. I'm the Round the Way Doc. So I'm giving you good information that's fact based, and I'm doing it in a way that it's easy for you to understand. I don't want to, tire you with jargon or get you confused with words that you're like, what is he talking about? So I really am trying to make sure I communicate, some very, very helpful information and keep the world happy and healthy.
I know that's right. Well, shoot, until next time, hopefully this outbreak doesn't get too crazy. Hopefully, when I have
Yeah,
you come back, we're able to talk
fingers
about something
crossed.
completely different. But if it's not, we will definitely have to come back and talk about it. And especially even if like COVID decides to be like, hey, girl, I'm still here. We'll have to bring you on to talk about that new variant.
Yes.
But in the meantime, between time, I once again want to thank you for stopping by and being my first interview on season 2 with Rewind with Besa.
Yay. I appreciate the opportunity. This has been great, and I'm here for you. I'm here to spread the good word of good health. So let me know when you need me.
Well, that was informative.